When I was born, they noticed that there were a lot of issues. My hemoglobin was really low. Doctors gave me transfusions, and when I was 6 years old, I got a cold that I couldn't get over. I had my spleen removed, and unfortunately that led to a clot and about 3 months in the hospital. It got pretty serious. My name is Tamara. It's still cold. I'm a registered dietitian, a nutrition scientist. Hot. I'm a mom, a wife. This was 4th grade. That was my Dorothy Hamill cut.
Young fair faucet head.
Yes.
Hair.
So I was diagnosed with PKD when I was 6 years old. It affected me because I just didn't have a lot of energy. I couldn't do the things that a normal 6-year-old could do. And then my skin was really jaundiced. It was really yellow. Dating was very difficult. I would get teased. People would avoid me. People would say that I had hepatitis and rooms would just clear out. I'm constantly aware of it. It affects every minute of my day. Feels like somebody is pulling you down into quicksand and you can't stop it, you can't fight through it, and you just have no option but to sleep.
Pyruvate kinase deficiency is a rare hemolytic anemia, rare hematologic disorder. At its core, a disease of not enough energy production in the red blood cells. Pyruvate kinase deficiency is characterized by the symptoms of anemia, so that includes fatigue, reduced exercise tolerance, sometimes an inability to go through a full day of work or school, but also the complications of hemolysis, so iron overload in the liver, the heart, other organs, osteoporosis, jaundice, yellow skin, yellow eyes, which can result in a lot of psychological issues. For rare diseases, unlike common diseases, it's not always clear what happens over the course of someone's life with that disease. In many cases, these diseases have no therapies. The PEAK registry is a global longitudinal registry, a study of patients with pyruvate kinase deficiency, keen on understanding the spectrum of disease, as well as how the disease impacts patients' quality of life over many years.
I was told that no one would ever look at PKD in terms of research. It was such a small disease, but people started researching PKD and there's drug development. It's shocking to me. It changed my world.
The epidemiology of PKD has, believe it or not really been fully worked out yet. So we think it's somewhere between 1 in 20,000 and 1 in 300,000 people. We're finally developing drug therapies, targeted therapies in this disease that target the pyruvate kinase enzyme, really rev up that enzyme's ability to produce energy, to produce ATP, to really alleviate the deficiency.
My hopes for the future are to find some sort of treatment for myself so that I can put more time into my family, put more time into my hobbies.
Landscaping.
And then most importantly is to get therapeutic options for the PKD community.
Hi.
Hi.
And then to be able to unite us so that we can get our voices heard in the medical community.